Hello, my name's Elaine, and I've had the opportunity to work with oncology patients my entire nursing career. I started off as a bone marrow transplant nurse and worked in an infusion center for years taking care of oncology patients. Now I'm a nurse practitioner still caring for cancer patients. If you're watching this video, odds are you or a loved one are about to start infusion therapy. As part of the PortReady program, I've been asked to give you an overview as to what to expect. Please make sure throughout the video, if you have any questions, you write them down so you can talk to your care provider. Okay, let's get started with the basics of vascular access and IV therapy. You may have heard the terms intravenous therapy, IV therapy, or infusion therapy being discussed when you and your doctor were making your treatment plan. But what do these terms even mean? Basically, they all mean the same thing. Infusion therapy is a way for us to deliver medications, which could include chemotherapy, as well as hydration and nutrition into your bloodstream. IV therapy is one of many options your doctor may choose when deciding the right treatment plan for you. When deciding on your specific treatment plan, we have a variety of options we have to consider. What medication or combination of medications will you be receiving through your IV therapy? What dose? How often and how long will your therapy last? Once your doctor prescribes a therapy regimen, they will also look at how this therapy will be delivered. Your doctor is going to be making these choices or offering recommendations based on a lot of factors. However, as a patient, the key consideration you need to know for your infusion therapy is that the vascular access option that is selected will affect you. You may have lifestyle considerations as well as concerns about long-term preservation of your arm veins. I'll be going over a lot of these different considerations and discussing the different options you have so that you can discuss this with your provider and loved ones. Peripheral IVs are commonly used for short-term IV therapy. Peripheral, meaning outside of your heart. These are the IVs that most patients associate with when having an IV in your arm or your hand. They're commonly used for short-term IV therapy or one-time use. The disadvantages of the peripheral IVs are that they may hurt whenever you're poked to establish the IV, or the medication you're receiving may actually cause damage to your veins. PICCs are another vascular access device option. They provide some advantages over peripheral IVs in that they're more reliable. They provide a higher level of comfort to the patient as you're not getting poked with needles as much, and they can be used for IV therapy over a longer time period. However, they do have some disadvantages. One of the disadvantages is that it's always hanging out of your arm. So when it's not in use for IV therapy, you've got to make sure your arm is wrapped where the IV catheter comes out of your skin. This can limit your everyday activities. Tunneled centrovenous catheters are external devices as well, meaning that they're not completely placed inside your body. They're placed in your chest rather than your arm like a PICC, and they can also limit day-to-day activities. Implantable ports are designed to be used for long-term repeat access over an extended period of time. While they do require a minor surgical procedure to be placed, they also allow for ease of access. In fact, by having a port, you're more likely to be able to go about your day-to-day activities, like showering or swimming. Sometimes peripheral IVs cause damage to your veins, so patients may end up needing to switch over to getting a port placed. The PortReady program is designed to provide additional information to patients and their loved ones about ports to help you on your journey ahead. Today, I'm going to go over some basic information about ports, how they're used, and how we place ports. You'll also learn what you can expect when you go in for your infusion and how your infusion nurse will be using your port and accessing it. As a nurse practitioner, I see many advantages and disadvantages of all these different vascular access devices that we've discussed today. However, eye-filled ports can offer some advantages over the other devices, and so that's why we're going to focus on discussing those today. Once placed, a port can remain for as long as your doctor makes sure that it works and determines you need it. Also, a positive advantage of ports is that they're designed to be placed underneath your skin, making them less visible to other people compared to external vascular access devices. Another great advantage is that it preserves your arm veins. This will be a benefit when you need IV access or blood draws in the future. In some cases, a patient may not be a candidate to receive a port. Your physician will help you determine what vascular access device may be right for you. So what actually is a port? A port is an implantable vascular access device that's placed beneath your skin. A port has a reservoir inside that's sealed with a soft top called a septum. It then connects to a small, flexible tube called a catheter. Ports come in a variety of different shapes and sizes to fit different patient needs. Some are single lumen and some are double lumen. Your physician will decide what's the appropriate size port for you. You may also hear the term power injection or power injectable port when ports are being discussed. Power injectable ports allow for special fluid called contrast media to be infused into your blood at a high rate for CT scans. CT scans provide a quick, accurate image of your body to help the medical team better manage your care. Not all ports are used or indicated for power injection of contrast media. Now that you know what a port looks like, let's talk about how a port is used and how it's placed. The port will be implanted under your skin, usually in the chest area, but your implanting physician will decide the best location for your port. The port catheter will be placed inside your vein, which is a vessel that returns blood to your heart. After your port is placed, your nurse or your physician will access your port using an aseptic technique. They should wear sterile gloves and a mask. Sometimes they'll provide a mask for the patient to wear as well, so that you've also protected the access site a little bit more. They'll use a non-coring needle to access your port while you're sitting in a chair or lying down. The needle they use comes in a variety of sizes, shapes, and colors. The length of the needle also depends on how your port is placed and where it's placed. Make sure to ask the nurse or doctor accessing your port what length needle they use. That way you can let future nurses know whenever they access your port. Before accessing the port, they will clean the area. This may feel cold or wet, but once the area is completely dry, you're ready for access. Remember to keep your clothes, hands, hair, or any other objects away from your port site during the procedure to prevent contamination. Depending on your therapy, your nurse may add an antimicrobial disc to the procedure. This is usually just a flat round sponge that goes between the skin and the base of the needle. It provides an added layer of antimicrobial protection and will remain in place as long as the needle is in the port. Now you may feel a mild pricking when they put the needle into the port, but this sensation often gets milder over time. Ask your doctor or nurse what you should expect. In order to verify the port is working right, your nurse will aspirate or draw blood through the port. After the nurse has accessed your port, she will then flush it, which basically cleanses the inside of the port, usually with saline. The last step in the port access procedure is dressing the access site. Oftentimes, a clear adhesive dressing will be placed over the needle, but some nurses may use a gauze dressing. Upon administration of your infusion therapy, the medication or solution travels through the infusion set and into your port reservoir. From there, the infusion travels through the port stem, through the port catheter, and into the heart to be distributed throughout the body. Your port can deliver medication or fluids in two ways. The first way is called a bolus injection. It delivers the medication all at once with the needle left in place for only a short period of time. The second way is a slow delivery of medication called a continuous infusion. For this type of medication infusion, a dressing will usually be placed over the needle to hold it in place for a longer period of time. Then a small tube will be connected to the IV bag that's delivering the infusion. Your port may be used for repeated access during your course of treatment. When your IV therapy treatment is all completed and your doctor indicates your port's no longer needed, it can be removed from your body in a short procedure. You might be feeling overwhelmed. We've discussed a lot of information here today, and you might be a little nervous about starting a new treatment. This is perfectly normal, and it's totally okay to have those feelings. Make sure you talk with your doctor about this, your nurse, or perhaps even a counselor or a patient support group that your doctor recommends. It's also a good idea to bring along a friend with you next time you go to your doctor's appointment. A friend can be another set of ears or someone that can take down notes to help you remember what you and your physician discuss or talk about. As a nurse practitioner, I want my patients to feel empowered and know they can come to me with any question they have about their treatment options. I've thought of a few questions that a lot of patients tend to ask me about ports and wanted to go over them with you today. One of the most common questions I'm asked is, will the port stay in me forever once it's placed inside me? The answer is no. It truly depends on how long your physician has decided you need to receive therapy. Sometimes ports stay in for a few months, sometimes they stay in for a few years. It really depends on what you and your provider have decided as the most appropriate treatment options for you. Another common question I'm asked is, will my diet change because I've had a port placed? The answer is no. Your diet will not change just because you had a port placed. A lot of patients ask me what they should wear whenever they're having the port placed, as well as what they should wear when they go in for their infusion. On the day your port is to be placed, you'll have a pre-procedure checklist that'll explain to you what you should wear on the day of the procedure. Oftentimes, you'll be placed in a surgical gown, so it really doesn't matter what you're wearing that day. However, I recommend loose-fitting clothing so that afterwards your clothing won't rub against your new port site. Another question I'm often asked is, what should I wear the day of my IV therapy? The answer is some loose-fitting clothing. You'll want to be comfortable during your IV infusion. It's nice for you to wear a button-down shirt so that whoever is accessing your port doesn't have a challenging time moving clothing around to get to your port. Many patients ask me if there are any physical restrictions once a port's been implanted. After the small incision has healed, you should be able to return to your daily life. Most physical activities are fine, but it's recommended you consult your physician about specific activities. Patients will ask me if there are any type of aftercare they need to do at the port site once it's healed. While there's no special aftercare needed, monitor your port site regularly, and if you have questions or suspect a problem, contact your physician. Patients will also ask me, is it okay to fly, and will this cause problems when going through TSA at the airport? No, it's not going to cause any problems. It's always advised to let the TSA agent know if you have some type of implanted medical device, but it will not interfere with flying. Remember, you can impact the way your treatment is delivered. Make sure you're involved in your care. Ask your doctors or your nurses questions about vascular access devices or different treatment options. Asking questions is a good thing, and we want our patients to be involved in their care with us, making decisions together. Thank you so much, and good luck.